Welcome, everyone. Welcome, welcome. Thank you for joining us. We are just going to wait a few minutes to let people sign in, and we will get started shortly. Welcome, everyone. We are just waiting a couple of minutes, and we will get started shortly. All right, well, welcome everyone. Thank you for joining us on this wonderful Friday, taking the time to enjoy your lunchtime with us. My name is Keisha James. I am the Executive Director for the National Capital Area Chapter of Autism Speaks. Our chapter supports the Washington, D.C. metropolitan area, the state of Maryland, and obviously for today, the state of Virginia. That includes the metro area and also Richmond and Hampton Roads surrounding areas. And so I work with a wonderful team who help to raise awareness of autism. Autism Speaks, and helps to coordinate and plan events throughout the state of Virginia. I'm excited today to introduce to you our field manager for the state of Virginia, Darcy Warren. Darcy, I think, is on here, and she'll say hello to everyone. Hi, Darcy.
Hello, everyone. Thank you so much for being here with us. Just wanted to come on and introduce myself. As Keisha said, I am the Field Development Manager for Virginia, and I am here to help our community come together, and I am in charge of our walks as far as a fundraising perspective in Richmond and Hampton Roads. But really, I am here for you all and wanted to make sure you knew that. I'm going to type my email into the chat box for all of you to have. And then also wanted to let you know that we have started a Facebook group just for Virginia. And so I will share that too in the chat once I am done speaking. Please go ahead and join our group because we will be sharing a lot of information on a daily and weekly basis that will be helpful to all of you. And if you ever need anything, please don't hesitate to reach out.
Thank you, Darcy. And thanks again to everyone for joining us. We are really grateful to share information with you about our organization and what we're doing to support autism families during this time. But for those of you who are new to our organization or have first time joining us for any informational webinar, I wanted to just make sure I share with you the focus of our organization and what our mission is. Autism Speaks is dedicated to promoting solutions across the spectrum and throughout the lifespan for the needs of individuals with autism and their families. We do this through advocacy and support, increasing understanding and acceptance of people with autism, and advancing research into causes and better interventions for autism spectrum disorder and related conditions. And today we are really pleased to share more information on how we are fulfilling our mission through advocacy and some of the programs and resources that we are providing you. I am excited to introduce my colleague, Judith Ursetti, who will take it from here.
Thank you, Keisha. You got my last name. Yay.
Wonderful.
I know. It is a mouthful. Thank you, everyone, so much for joining us on a Friday afternoon, probably one of many FaceTime or Zoom sessions you've had this week. So thank you so much for taking time to learn about what's going on the federal level, on the state level with regard to autism and advocacy. It's so important that we be aware right now so we can be effective advocates and make sure that our community has what they need during this very challenging time. So we so appreciate you being here today. As you know, just when we think we've faced it all in the autism community, we turn a corner and it's a journey none of us ever expected. And so many of us are facing situations that are extremely challenging right now. And at Autism Speaks, we sincerely want that to drive the advocacy that we engage in on the federal and the state level. So some of the challenges that we've heard about from self-advocates, from moms and dads and siblings, from teachers, from healthcare providers, all our community. We've heard about, of course, the disruption, just the rug being pulled out with regard to educational services, day programs for adults with autism closed, clinics where healthcare is accessed closed, shifting to telehealth, which for some is okay and for others is just an impossibility. Mental health supports for people with autism, for their caregivers, for their siblings. The lack of connection that we're all feeling in general, but especially I think those who are on the autism spectrum. Many of you who know me know that my son Jack, one of his big connections is every Saturday night we go to Outback Steakhouse, and when we walk in the door, the staff, they know Jack's order. We've been going there every Saturday night for years, and for him it's something that he asks for every Saturday, that connection. It's not just the wings, it's the people, it's the experience. It's so important to feel that connection. And he's missing that. Yes, we're doing the takeout, trying to support the business, but it's not the same. So those little connections are lost right now. The severe disruption of employment opportunities for people with autism who've worked so hard to become good employees. They're the best of employees, and those opportunities are limited or gone right now. Respite relief for families. Autism is a 24/7 situation for so many, and sometimes families need support and help coming into their homes, and right now that might not be available, and that can lead to really challenging experiences. Disruption of routines, loss of income for families, as if life isn't hard enough and expensive enough when you're dealing with autism. The loss of income for providers, it's so hard. And then of course there are challenging behaviors that people all across the autism spectrum can experience, especially during times of stress. It can be self-injurious behavior, it can be aggressive behaviors. It's so stressful and hard for the families. And then of course, access to healthcare during this time is frightening for everyone. But when you think about people with autism, potentially having to be hospitalized or in a healthcare setting without their caregivers or the appropriate accommodations or support. We're hearing stories about that are really difficult to hear. So we're trying to do all we can on the federal and state level to address those things. And we're going to talk about many of them today. And as we go along, you might have questions. I know it's probably been said already in the chat box, everyone's muted just to save bandwidth right now, but you can certainly type your questions in the chat box because we want to be here for you, provide answers to you. Some of the questions might be really individual in nature. We all have unique journeys. If we can't answer broadly right now, please know that our autism response team is here for you. You can call them at 1-888-AUTISM-2. There's a Espanol, there's a Spanish speaking person, there's a number you can call. And then of course you can email help@autismspeaks.org. So, and also know that this webinar will be provided, a recording will be provided, as well as the webinar itself, the PowerPoint after this event's over. We're gonna send this out to everyone because we want you to have information that's meaningful and helpful. Okay. All right, so what are we going to talk about today? We already heard from Keisha and also Darcy too, who are there on the ground doing such a great job. First up, we're going to hear from Angela Lello. She's going to tell us what's going on in Washington, D.C. And I know sometimes some of us are really into what's going on in D.C. and sometimes we're like, oh, I don't even want to know. But right now, all the wheels are turning so quickly and everything is so integrated. What happens in D.C. a week ago affects us on the ground right away. So Angela is going to update us on that. Randy and I will update you on state advocacy. I'm going to introduce Randy in a little bit. And then Janet Williams, who's our incredible community outreach person, is going to share some resources with all of you. So now the exciting part, I would like to turn it over to Angela, who's going to give us the DC update. Angela, please take it.
All right. Well, thank you guys. Thank you, Keisha, Darcy, and Judith. I'm so glad that we can come together for everybody here in Virginia. So as Judith and Keisha mentioned, I'm Senior Director for Public Policy. I'm one of the lobbyists for Autism Speaks in Washington, D.C., but I'm actually in Northern Virginia. So I am here with you all, and I'm really glad to be talking to y'all. So just to give you a quick review of where we are today, at the beginning of March, Congress passed their first set of 3 coronavirus response legislation. And that really was a supplemental appropriations that provided a bunch of funds in emergency public health funding. Then shortly thereafter, Congress passed the Family First Coronavirus Response Act. And that was the act that established the paid emergency sick leave and family leave for individuals who are either out of work because they were sick or caring for someone who was sick, or they were out of work because their child's usual place of care or school had been shut down. It also provided for tax credits, funding for other things related to COVID testing and some healthcare costs. But then it also included a 6.2% increase for Medicaid, federal Medicaid funds, and that's across the board. So all Medicaid services were getting additional funding from the feds. Then very quickly thereafter, just a few days later, Congress passed the third of its sort of coronavirus response legislations, or COVID-3, as we've been calling it sort of colloquially. And that's the Coronavirus Aid, Relief, and Economic Securities Act, or the CARES Act for short, which provided a lot more funding to help alleviate some of the problems. And when the Speaker of the House talked about Congress's plan and approach at dealing with and responding to COVID, she said that their first action will be to respond to the emergency. And then their second actions were really to help mitigate or stop the bleed of everything that was transpiring. So the way she characterized the first legislation was Congress's emergency response, and then COVID 2 and 3 and 3.5, which I'll mention in a minute, were really mitigation activities, and Congress will then turn to recovery. But so part of their mitigation was to provide billions of dollars in relief funds across the board for a number of different areas: small businesses, public health response, schools. We also included in this package economic impact payments. Some of you might have received yours already. You might have heard these referred to as this individual stimulus payment. But so this third package really contained a lot of the funding that was designed to plug holes in sort of the safety net, that the holes that were emerging as this crisis unfurled and further impacted so many people across the board. So I think the important thing for us in the last CARES Act were that it included billions of dollars for schools. It also extended an important Medicaid HCBS program known as the Money Follows the Person program through November. But the money that is going to schools, I think Judith and Randy will talk about how Virginians can really tap into that. And these billions of dollars will go directly to schools in some cases, and then Governor Northam has an emergency education relief fund that he'll be able to use as he sees fit. So that's sort of what's already passed heretofore. The other day, just last week, there was a 3.5 package that was passed. And this 3.5 package, well, that's what they're calling it. You know, people inside the Beltway come up with these names. I have no idea. Don't ask me. The point is, they passed another small stopgap measure just the other day on the 24th. And this is really looked at as an interim bill, and it basically only provided replenishment or authorizations of additional funding to replenish the small business payment protection program, which had run out of money. And that was the relief program for small businesses that had less than 500 employees and who were trying to forestall laying people off. And then it also included a limited scope and addressing additional provider payments. So that passed on the 24th, and work has focused now onto the next package, which folks have referred to as COVID-4, could be 5, depends on who you talk to and whose math you're following. The timeline for this next legislation, which as you recall is what Speaker Pelosi referred to as the recovery package. And she indicated that there might be multiple recovery packages that Congress will have to consider and pass. So we know that they're planning on introducing one more bill in short order. The House has tentatively said that they would be coming back to DC on May 18th. This date is a moving target, and it has moved already at least twice. And it's based upon basically the safety of the members of Congress as well as the staff and supporting personnel in and around the Capitol complex. We today expect people to be come back into DC for work next week. And we're hearing that we could see a shell bill or just an outline of what will be in legislation for COVID-4 as early as Monday. We are expecting more details and the actual concrete legislation that will be voted on probably by Tuesday, Wednesday, with a vote as early as possible as the 18th. Again, this timeline is still very much to be determined, and that is what the House has planned. What we're hearing from the Senate is a much different story. We're not even clear if the Senate is going to agree to passing an additional COVID relief legislation, especially because many of the priorities of Senate leadership right now have been addressed in the last 2 packages that were passed. So there definitely is not a done deal, definitely have an uphill battle. But potential items that will be contained in these bills include things such as additional funds for the public health response, additional economic relief for families, individuals, small businesses, of course, money for state and local governments and education, nutritional assistance programs, food stamps. There's been a lot of recognition that there are some intense food and nutrition crises taking place across the country. So food stamps, home delivered meals, those might get an additional boost. There also is an emerging issue with the United States Postal Service that is pretty much unrelated to COVID, but it has to be addressed and fixed. So we expect something might be included in this legislation to deal with that. And then also probably a significant amount of infrastructure investment. Now, we're also hearing that one of our priorities, additional funding for Medicaid HCBS, is likely to get into the shell bill or the base bill that's starting in the House. At least that's what the readout is today, but things change frequently and quickly. And so we definitely are continuing to keep up the pressure. So that's sort of the lay of the land today. But if we go to, there we go. I do want to sort of talk to you about a few different things. So first is the economic payments in SSI. One of our concerns when CARES was being negotiated was that beneficiaries on SSI would not have to file an income tax. So we were really pleased to see Treasury made it so that SSI recipients didn't have to go back and file an additional documentation to receive those economic impact payments. There was additional documentation required if you were an SSI recipient and had dependent children. So we sent out some information about that, and stay connected with us if you want to hear updates. There is still a problem in that adult dependent children who are disabled. So for many of you, you might have disabled adult children who still live with you, who you still claim on your taxes, and you probably realized you did not get a stimulus payment for them. Children under the age of 17, their parents received a dependent credit for them of $500. And however, parents of adult disabled children did not receive that same credit. And it's a glitch essentially that resulted from the way the bill was structured, relying on a definition of a child 17 and under. So we're hopeful and we're supporting legislation that would correct that so that all dependents, whether they be over the age of 17 or otherwise, would be eligible for those economic impact payments going forward. As of now, unfortunately, adult dependents were just left out of the stimulus. The next thing that I think Judith and Randy will talk a lot about is the distribution of education dollars and how those are being distributed at the state and local level. I think we're keenly interested in that. The legislation did not specify that those dollars were for special education or general education. So there's a lot of discretion there. Many of you might have heard that the Secretary of Education was required to submit a report to Congress about whether or not a waiver of IDEA should be granted to deal with this pandemic. Fortunately, the Secretary released a report the other day, and she said that a waiver of the legal protections and the statute within IDEA was not required. And we have consistently said that we would oppose any waiver of IDEA, and we are very grateful that her report agreed with us and many other disability advocates in retaining the rights of students with disabilities. When the emergency paid and family leave was included, it said that it was available for parents who have children whose school or childcare was closed. What it did not include is it did not include provisions for what happens if you have an adult child attending a day program. Maybe it's not school. We commented to the Department of Labor and strongly urged them to, in their rules, allow this leave coverage to apply to parents in that situation. And fortunately, they agreed with us and many of the other disability advocates who commented similarly. And so as a result, this emergency paid and family leave is available to parents of disabled adults who maybe aren't in school anymore, but their usual source of care is no longer available. So those were some things that we were also very pleased with. And just today, in the last couple of days, we've learned that HHS is going to use its provider relief fund, which I mentioned was hundreds of billions of dollars made available for the public health response. Initially, the feds released that money directly to providers based on how much Medicare claims and expenses they had. There was a lot of people that were very concerned about providers that serve people with autism that primarily use Medicaid funds and don't have any Medicare reimbursements. Autism providers weren't the only providers that had these concerns, but just recently, just this week, CMS has announced plans that they are going to be getting relief payments to Medicaid accepting providers. So this would be autism providers that provide ABA, as well as Medicaid home and community-based services providers that serve children and adults with autism and other developmental disabilities. So it'll be a few more weeks yet before these provider payments start flowing. CMS is just now figuring out the logistics. And so we were very pleased to see that development just unfold recently. So that's sort of implementation issues as they stand today. For Autism Speaks, we have prioritized a number of different asks during this congressional debate. Number one has been additional funding for home and community-based services and services for educational funding for students with autism. So we would like to see an increase specifically for HCBS and IDEA services in the next package. We are also very strongly fighting to make sure the rights of students under IDEA are not eroded. Although Secretary DeVos issued that very good report, we know that there are efforts by administrators of special education and superintendents to lobby Congress to allow or to create a waiver of liability under IDEA. And so we want to make sure that, you know, we are continuing to advocate for the protection of our community. Flexibility is important, but flexibility is a lot different than waiving liability and waiving certain protections. So we're going to continue to fight for that, but also at the same time, we want to make sure that telehealth services are expanded and shored up where needed. And like I mentioned, you know, that adult dependent issue, it's critical for so many parents trying to make it through this pandemic. So the last thing I'll note is that we are continuing to advocate for and support efforts to prevent discrimination in treatment decisions. You might have heard about care rationing and what happens when a healthcare system is sort of at capacity and how the healthcare system has to triage treatment decisions based on certain factors. Our congressional champions helped lead the effort to get Secretary of HHS to say you cannot use someone's underlying condition like autism as a way to prevent them from getting a ventilator if they come to the hospital because of COVID. And there's a lot of other finer sort of implementation issues that we're still continuing to watch for to make sure people with autism aren't facing discrimination when it comes to treatment decisions about how to respond. So we're continuing to watch that and supporting our congressional champions in their efforts as well.
Thank you, Angela. I think we're going to do a little bit of Q&A now. Kelly, do we have anything we need to talk about?
Judith, so far we have one question that'll be relevant to the state section. So I think you can keep rolling. Thank you.
Okay. Thank you. Thank you, Angela. And that was Kelly Hedrick, who heads up our grassroots and state government affairs team. And so she is talking to all of you via chat. So thank you, Kelly. This is a tag team approach for sure. All right, so now I always say the state, that's where it's at. You really get things done on the state level. Sorry, Angela. So at this time, I want to introduce you to Randy Pearson. Randy has been working on behalf of the autism community for many years. Right now, he serves as a contract lobbyist for us in Richmond. But before that, he worked in the General Assembly. And Randy, I'll let you kind of share a little bit when I hand it over to you, but he has been such an advocate for our community. And Randy's going to fill you in on what's kind of going on in Richmond right now. And then I'll talk a little bit about some of the specific things that we're focusing on from an advocacy perspective. So Randy, turning it to you.
So as Judith mentioned, I had the privilege of getting to know her and Autism Speaks and many of the folks in this community in my previous role, where I was working for a member of the General Assembly, Delegate Tag Greason, who was integral in putting forward the legislation that initially created insurance coverage for some children in Virginia, and then ultimately we got to the goal recently of eliminating the age cap entirely on insurance, and that was my former boss, Delegate Greason, kind of helped get that ball rolling, and I had the privilege of working alongside him when that was happening and getting to know Judith and other folks as that process was happening, and just have been, proud and honored to be a part of that process, and just a small part of that process over the past few years. So, but shifting to talking about this year and what we're working on in Richmond and what's happened over the past few months, it has been a historic couple of years in Virginia in many ways, some good, some bad. But really, starting off talking about this year, the starting point would be the power shift that happened this year, and that was a historic moment for Virginia, with Democrats taking control of the House of Delegates for the first time in 20 years. They also took control of the Senate by a very narrow margin of 21-19. And so now Democrats in Virginia have control of the General Assembly, as well as the Attorney General's office, Lieutenant Governor's office, and the Governor's office. Complete control, but again, narrow margins in the General Assembly. So bipartisan work is still very, very important in the legislature. So during the past session, our primary focus, as you can see on the slide, were two bills. Senate Bill 1031, carried by Senator George Barker from Fairfax, and House Bill 1503, carried by Delegate Jawan Ward from Hampton. And what these bills did was they really were aimed at closing one of the last loopholes in insurance coverage that existed in Virginia for autism families that are dealing with autism. I mean, what had happened in previous iterations of the bills creating the insurance coverage and ultimately raising and getting rid of the cap was that there was a carve out in those bills that exempted small businesses with less than 50 employees in Virginia. And that was to address concerns from some business interests and also from some legislators who are very concerned about costs. And ultimately the decision was made, if we can get the bill through with that carve out in, it's better than not getting a bill through at all. And so that was still on the books as of this year. And so we went in with a bill that got rid of that carve out and essentially said, if you have an insurance plan in Virginia, whether it's a small group, individual plan, or any plan in Virginia, you must provide that coverage and have that insurance mandate applies to all plans. That was certainly by no means an easy lift, but thanks to some very hard work by Judith and her team and many advocates from across the state, we were able to get that through. And also because of the hard work of our patron, Senator Barker and Delegate Ward. I'd also be remiss if I didn't mention Delegate Paul Krizik from the Alexandria area, who put in an identical bill to House Bill 1503 for us, and ultimately was the chief co-patron of the bill that passed. Should also mention some of our co-patrons as well. Delegate Kilgore from Scott County and Southwest Virginia, Delegates Lamont Bagby and Jeff Bourne from the Richmond area, Delegate Lopez and Delegate Mike Weber from Arlington and Fauquier, respectively. Republicans, Democrats, Northern Virginia, Southwest Virginia, Hampton Roads, Richmond. So it really was a cross-region, cross-party effort to get this across the finish line this year, and we ultimately did. And you can also see on the state legislative information system website all the votes that were taken on these bills. They did pass with overwhelming support, which we were thrilled to see this year. That has not always been the case in the past. Some of these bills have unfortunately not made it across the finish line or have been a real partisan struggle or struggle between different interests, but that was thankfully not the case this year. I mean, I think that's because of the hard work of so many folks that are probably on this webinar and folks who are involved with our advocates doing the work on the ground. And yeah, I would just say, before we move off of those two bills, I think it's really important for folks to take a look at who did vote for those bills this year. Check and see what your delegate and senator did on those bills, and if they were supported, which most of them were, take a second to write them a note and say, thank you for your support. Thank you for being engaged with our communities and taking time to learn a little bit about our issues, because it just goes to a long way with those folks who often all they hear from folks is problems and issues. If you take that second to reach out to them and just thank them for their support, it can go a long way for when we come to them in the future, which we will, with other policy asks and ask for our communities, if they know that these folks, that we are grateful and that we do notice when they do take action in support of our priorities. So I think would encourage everyone to take a look at that and take a moment to do that if you can. A couple other things on the legislative side that we worked on this year that did pass. I'll just note a few. House Bill 65, carried by Delegate Jason Miyares from Virginia Beach. This created a specific missing child alert for children with autism. Again, passed overwhelmingly with broad support. We're happy to support that one. And a couple other bills, House Bill 1143 by Delegate Kathy Tran and House Bill 1722 by Delegate Donica Rome. These are bills that have been put forward on behalf of the Virginia Association of Behavioral Analysts in previous years and have not been able to get through, and we're able to get through this year, thankfully. Basically allowing localities the option to bring on licensed behavioral analysts or assistant behavioral analysts, and also asking DOE to create the guidance around those behavioral analysts in schools in Virginia. And so we were happy to see those get through, and we think that will be a very positive thing for Virginia. And also it was nice to see you make the case plain to legislators. This is not an additional cost to localities. This just gives them the option of bringing these staff on board, which can be very beneficial to their students. So that's a very high level look at some of the legislative work we did this year. Judith, do you want me to just talk very briefly about the budget as well while we're on this? Okay. So in terms of the budget this year, again, as we all know, this was as I said, a historic year in many ways. The governor also put in his biennial budget this year. Back in December, he introduced a brand new 2-year budget. This included a lot of new spending in different and dynamic ways in education and healthcare, mental health, many different areas, and a lot of great new programs that ultimately did go through. Almost everything the governor proposed did go through the General Assembly along with some of their priorities as well. But everything has changed since the pandemic struck and since we've had this economic shutdown. The General Assembly met for their reconvene session a couple weeks back, which they do every year in April, take up the governor's amendments and vetoes to bills in the budget, and they essentially had to walk back almost all new spending. So a lot of things that were put in that original budget had to be unallotted just because of what we're anticipated to be a significant revenue shortfall. So we will continue to monitor that. Thankfully, none of the bills I've mentioned previously had a fiscal impact on the state budget, and so we were not; those bills were not negatively impacted by this walk back of some spending. And existing spending has not been cut back yet. I say yet because there is likely going to be a special session, as you can see the bullet there on the slide, later this year. I think the governor has indicated he wants to hold off until we have a better view of the revenue forecast in Virginia, which will likely be in late June, July, it'll be early August when we see more what we start reopening and we see what more of the impact has been on the state's economy. Then I believe he will be calling the legislature back into session in Richmond to take up these budgetary issues. And the way special sessions work is they are typically very narrow in scope with a very specific task. And in this case, it's going to be the budget. They're going to come back and essentially have to redo all of the budget work that they have done or that they did in the regular session during January, February, March of this year to address the projected shortfalls once we have a better handle of what that will be. There may be, again, this is speculation with the governor, once he has a better feel of what that shortfall is going to be, he may put out a just blanket to every state agency and say, you've got to cut 5% or 10% or what have you, or they may try and be more creative, but we do anticipate there being some, like every state's going to experience some pain in terms of the budget as we get through this recovery. But on the good news front, the governor does have, as Angela mentioned, some significant funds that have come from the federal government that he has broad discretion to use to address issues across the Commonwealth. And one of those things that we have, we've been pushing on in that regard is using some of those funds to help some of the issues around equity and education, helping with our private day schools, helping with access to services. We have recently put in a new request to his office, among others that we've already put in since the reconvene session, asking him to take action on behalf of some of our priorities. Now, I know Judith's going to talk a little more about that, but again, that's a very, very quick and high level view of what's happened legislatively and with the budget this year. I'm happy to take any questions, but again, it's as I'm sure is the case in every state, it's very much a dynamic situation right now because we're all kind of going day by day and week by week in terms of what's happening with the pandemic and what our next steps are going to be. So I'll leave it there and happy to help answer any questions if there are any.
Thank you so much, Randy. Super helpful. And it's just so important for us to have Randy's presence in Richmond day to day. He's, just staying on top of all these issues for our community, especially during this challenging time. So Thank you so much. Before we get to questions, quickly, I kind of want to talk with you all about what Autism Speaks from a state advocacy perspective is focusing on, just trying to make sure we're staying focused and the work that we're doing is meaningful. So we're looking at healthcare. I know Randy already mentioned the bills that we had worked so hard on this last session and over the last 10 years, really trying to make sure that people had access just to evidence-based treatment for autism spectrum disorder in the private health insurance market. There's also Medicaid coverage too. Home and community-based services. You heard Angela talking about HCBS. It's home and community-based services. Those are funded through Medicaid. And then special education, early intervention. Those are the things during this crisis we sat down and said, okay, what can we do right now to make sure that, you know, just minimum supports are available? And so these are the things we've been advocating around. First of all, with regard to healthcare, CMS, which is the federal agency that oversees Medicare and Medicaid, has been extremely flexible over the last month, well, now almost 2 months, while we're experiencing the pandemic. So something they've offered for Medicaid health plans, so for people who have their health insurance through Medicaid, through DMAS, is an 1135 waiver. There will be a quiz at the end of this webinar with all the acronyms and numbers that are referenced. There won't actually, but I know it's a lot of numbers. But anyway, the 1135 waiver allows some flexibility for health insurance coverage in the Medicaid world. So in Virginia specifically, it modifies state hearing requests and the appeal timelines. Medicaid fee-for-service prior authorization requirements are suspended temporarily. Things like that, pre-authorizations. And there is a link here if you really want to read the entire waiver, and we will be providing this presentation afterwards. So these links will be provided to you. Continuing on the healthcare front, we've been advocating for meaningful telehealth for our population during this time. You know, telehealth is always a good option in certain circumstances when medically necessary. But in this situation, it's kind of almost all we have. So early on, DMAS came out, they issued guidance on March 20th, expanding telehealth coverage to all Medicaid providers, and this includes behavioral health, early intervention, all the waiver services that you all utilize. You should be able to have an option for telehealth delivery. And I totally concede, I have a son who has autism and a severe intellectual disability. Attending to the screen sometimes is hard. It doesn't work for everyone, but we want to make sure that option is available and there just for a minimum during this time. We also, we talked about Medicaid and telehealth there, but what about for private health insurance plans? In many states, the governors have come out and just instructed all the health plans delivered in order to require telehealth coverage at the same rate, you know, all the same supports as, you know, when something's provided in person. And we've not yet seen that come down from Governor Northam. We did, as a coalition of organizations, send a letter requesting this telehealth coverage for those private health insurance plans. And we did it as a coalition, which we frequently do in Virginia. I love the way we all work together. So Virginia Autism Project, Autism Foundation, Autism Society of Central Virginia, and others signed on to the letter with us. We worked on it together, requesting that telehealth order from the governor. And we sent that to the HHS Secretary Carey recently. And we've not heard back. We are hearing, I don't know what your experiences are if you want to share those. We are hearing that the private plans are covering some telehealth. But if you are having issues, we do want to hear about that because this is an advocacy focus for us. All right. As I said, Angela mentioned HCBS, home and community-based services earlier. So those of you who use those waiver services in your homes, or perhaps you have a loved one with autism who's in some sort of day program, this is outside of private health insurance. This is outside of the educational system. These are waiver services. And so CMS came out early on after the pandemic really started affecting the country and there was a national emergency. And they offered this tool that many of us had never heard of called Appendix K. And so Appendix K allows for some real flexibilities with waiver services. And Virginia's Appendix K was actually just approved just a couple weeks ago. And so some of the flexibilities that are in Appendix K, it permits different settings for delivery of services. So if you're in like a group day program, you can actually receive those services at home in an unlicensed facility. That's just kind of an example. It temporarily modifies provider qualifications. Some of the screenings that normally have to take place when providers are brought in, they're lifted right now temporarily until we get through the pandemic. It allows for retainer payments for programs so that they don't go under during this time if they're not being paid as they normally do. And allows spouses and parents of minor children to be reimbursed as the personal care providers. So different things like that are provided under Appendix K. And the Appendix K provisions are available in Virginia till June 30th, which is kind of a short window. I will say that other states across the country, I think about 37 states have now had an Appendix K approved. Many of those states are going out a little further with these temporary adjustments under Appendix K. It will be interesting to see if Virginia will need to do that too. I anticipate they will. But for information about what's going on right now with Appendix K in those waiver services, you can click through on the links on this page. All the wonky stuff is in there. All right, moving forward.
Judith,
yeah, go right ahead.
I was going to say, just before we move off those two topics, the telehealth and the waiver as well, I think it's really important just for us to get feedback from folks on what is working well and what is not working well. Both are, I think, equally important because, I mean, I've already heard in some of the conversations I've been on and some of the calls I've been on about, folks saying, well, this is working really well with telehealth. Maybe we should extend some of this out going forward or use this. In some cases, that could be a very good thing, but in some cases, it could also be very damaging or harmful if people start saying, oh, this is working great during a crisis. Let's just keep doing it, going forward. And so I think it's very important for us to get feedback from folks who are experiencing this day to day on the ground. Going into the next session of the legislature or the special session, is there something we need to be flagging for legislators? Say if you see legislation to do this, either yes, this is a great idea, or no, this is a terrible idea and we need to stop it, or what do we need to be doing proactively to be putting forward to say this worked really well, let's get it written in stone, or this was really bad, we need to fix it, make sure it doesn't happen the next time there's a crisis. So any feedback that folks have, I would just encourage folks to share that with us so we have it and have it as a in our we know about it. It would be great to know.
Yeah, and I think, our community is so complicated just because of the different levels of autism that people experience. And we want to have appropriate options that are evidence-based, but you don't want a certain option like telehealth just applied broadly, permanently, that replaces something that's in person and important. So having the option is really important, but making sure that services aren't diluted. Unfortunately, we don't always trust what the health plans or what the agencies are going to do because they're always looking for ways to save money. But our population needs evidence-based services and supports and options. So absolutely, your experiences, we really need to hear them, good and bad. All right, moving on to our favorite topic, special education. We've been focusing on that a great deal over the last few weeks. We're very worried. We're hearing from families about how just the system is not working. The Virginia Department of Special Education did come out with guidance. I have a link to it here that talks about the free and appropriate public education that has to be provided during this time. But many of you know, those words aren't necessarily being applied in a meaningful way. And it's challenging. We hear from special education teachers who are, buying materials for their students who can't do teleeducation. And so they're, instead of sending home a packet that's not appropriate, they're creating things, for their students, and they're spending money that they don't have. So we know there are teachers that are doing their very best. We also know families are struggling who have children with autism who just are struggling being separated from their educational programs and the supports, many of which need to be provided in person if at all possible. Angela mentioned, and Randy mentioned too, there's money coming down to help for this. So you're going to hear a lot in the news about how awful everything is with the budget, and it will be, and it is. But there is a lot of money coming down from the federal government through COVID-3, and we hope in future legislation that's coming down from DC. But right now, for K through 12, there was $222 million allotted to Virginia, and that, Randy, you can correct me if I'm wrong on any of this, is being allotted to the districts based on formulas. A big chunk of money came down for post-secondary education, and that, of course, too, does affect the autism population, $320 million. We've been focusing on the governor's discretionary fund. $65 million came to Governor Northam for him to use to try to help in the education realm during the crisis. And it's supposed to help populations that are really disparate or struggling. And so special education falls into that bucket. And so we've asked for specific things. We actually submitted a letter, that coalition that I mentioned before, just submitted this letter recently. And so we're focusing on making sure that the private day programs are getting paid because they were not, and it was very inconsistent with the different local education authorities, what they were doing. We want to make sure that the little ones who are in early intervention right now, but who are aging into special education at age 3, are not being pushed into that without the appropriate transition services. So if that can just be paused for a moment and they can just stay put for a little while till all this crisis passes and then move into special education, that seems to make more sense. We're very worried, as I mentioned, just about the services that are lost right now in the special education world. And many people are already thinking down the road about what their compensatory services are going to look like once school resumes. We want to start working towards filling that gap now. The state of Virginia, the Commonwealth of Virginia, can actually address that now. They can use the funds the governor received to work with school districts to get them to provide programs now over the summer with educators to start that learning now and do it in as meaningful a way as possible. And then the other piece we're worried about are those who are aging out of special ed into the adult world. That transition is so important when we're not in a pandemic, and right now to be forced through and transition when there's not a plan available and the appropriate transition can occur. We just want that to pause too and be extended if possible. So those are the things that we're focusing on from a special education perspective, and I've gone on for a very long time. I don't know if you all have questions or suggestions. Kelly, do we have anything that we need to answer during the webinar?
Yes, a couple of questions and a bit of input on one healthcare coverage that's still troubling. So question for you or Randy, group homes have been closed to visitors and families for 7 weeks now in Virginia. Any status updates on when that will change?
Mm-hmm.
Sure. So I would just say that the governor, as folks may have noticed in the news, has, in the last week or so, started to talk about moving into phase 1 of reopening, and then laid out what phase 1, phase 2, and phase 3 very broadly, very high level, what they may look like. Today at 2 o'clock, he's having another press conference that's talking much more specifics about what phase 1 will look like, regulations and implementation of phase 1, and just diving into more specifics on that. I know this is an issue that folks have been asking about. He has not, to my knowledge, released any specifics yet, but I would say stay tuned. Tune into the governor's press conference if you can today at 2 o'clock. It's available on Twitter, on Facebook, like NBC 29 and several other local news stations usually carry it live on their websites as well. So if you want to check that out, you can. He is holding press conferences also usually 3 to 4 times a week right now at 2 o'clock during the week. But I would say today in particular would be a good one to check in on, but he has not released any specifics yet, to my knowledge.
Okay, thanks, Randy. And we know that's a heartbreaking situation when you can't see your loved ones. So we are thinking of all of you that are in that boat.
Mm-hmm.
Another question that's state focused. regarding relief for ABA providers, what would the requirements be to receive any related relief? Do you have any details, or is that a follow-up offline kind of a question?
So I know Angela mentioned the provider relief fund that federally has been provided. And Angela, I don't know if you want to weigh in more, but billions of dollars have been made available to Medicare providers, and now they're opening up to ABA providers who accept Medicaid. The other piece, and we can provide that information if you want to contact us afterward. Or Angela, I don't know if there's anything you could put in the chat box right to help people link.
I think that's right, Judith. And I would just say it's not limited to ABA providers. It's all health providers.
Right.
And I would say stay in touch with DMAS and then watch sort of what you're hearing from the Federal Centers for Medicaid and Medicare and Medicaid Services.
Yeah, and then the other relief too that providers, ABA providers specifically, have been trying to take advantage of are those small business loans, which I know have been very hard to access. More funds have been placed into those programs, but I know that's challenging, and there's the whole thing around loan forgiveness and what that really looks like for providers. But that is another option I'm hearing, but we know it's very difficult for providers out there, and not all providers accept Medicaid. So there's got to be some other options besides the provider relief fund too. So definitely we want to make sure that there's funding options available for you guys.
Great, thank you. One more, and then there's one that requires a little bit of brainstorming with the person who asked the question. That can be done offline, but this one is, any word on TRICARE allowing telehealth? So far, they're allowing parent training via telehealth, but not for staff to see clients that way. This person is continuing to see clients, whether paid or not. So thank you, Jamie, for that. But just wanted to share that news about TRICARE and see if Angela has any update on.
So I don't have any updates yet, but we're working on it. Our understanding is that TRICARE has made the decision to not cover one-on-one ABA sessions and only cover the parent training via telehealth because they are not aware of evidence that ABA is effective one-on-one via telehealth. So we are working with congressional champions right now to correct that. We think it's just an error on their part, but it is decision that has been made sort of at headquarters, and we're trying to get them to reverse that. But I don't have a timeline for you.
Tomorrow, Angela, come on. Put it on your list. All right. So I know we're running a little short on time, and I want to make sure that you all get to hear from Janet too, because she's got some really good information about community resources. So if you can, please stay with us. Janet, please share with us this important information.
Wonderful. Thank you, Judith. And I just want to say before I get started, and I'll be very brief because of time, happy Mother's Day to all of the mothers out there. You deserve everything, every great thing that comes your way. So, you know, from Autism Speaks to You, I just want to say happy Mother's Day. Next slide, please, Judith. What I want to share with you is that, you know, since the COVID-19 pandemic, it hit our communities, Autism Speaks from the start, you know, we took swift action to respond to the needs of, you know, people with autism and each of their families. In response to the news of the rapid spread of COVID-19 at the beginning, you know, our advocacy team has been working very, very hard, as you just, you know, as they just shared with you. And I just want to say thank you to each of them. And what I want to talk about is just some COVID-19 information and resources that we have available. So first of all, if you visit autismspeaks.org, on the homepage, you'll immediately see a yellow banner that kind of drops down. there's an area to click on that banner. We have so many resources available for you there. And, you know, we just want you to know that we know that life has been very, very challenging for our families. And it can be especially hard for autistic people. So, you know, what is happening around the globe, it has forced us to adapt as best as we possibly can. We are confronted with radical shifts in our schedules, having to utilize different modes of communication like we're doing right now with Zoom, changes in social demands, and increased safety risk, which is causing us to wear masks and to social distance from one another. So it has, you know, imposed adversity in the form of challenges with health, of course, economic stability, and our overall general well-being. So as these concerns, you know, rise, we continue to fulfill our mission, listening to the needs of the autism community to offer guidance and support. On this sheet page here, and we shared it earlier, is information on how to connect with our autism response team. Our autism response team, you know, members are specially trained to provide information and resources, and they are there, and they're there to help you and provide you with resources and information. So please reach out to them if you're in need of financial support, or if, you know, just whatever you need to connect with them with, please reach out to them. They can try and connect you with grant opportunities that may be available. And again, their contact information is on this screen. So, you know, I just want to share some additional information with you that since schools are closed and, you know, people have found themselves faced with numerous obstacles, we have put together wonderful tools and videos in which, you know, can help families adapt to all of these sudden changes in the routines. We also have, as you can see there to the bottom left, an Ocali Autism Internet module. And these are a series of free online trainings on a variety of topics. They provide high quality information and personal development for anyone who supports, instructs, or even works or live with someone with autism. So there are a lot of links that are available, a lot of resources, there are videos, and this information is being constantly updated. And when you go to that page for any new items that have been included, you'll see, you know, a little notation out to the side that just says new. So please visit our website for any information and resources, and definitely reach out to our autism response team. And again, I just want to say thank you. So no matter what, you know, just hang in there. You know, remember, we're always here to help. And here's some information where you can search by topic on our autism resource guide. So we have a lot of toolkits that are available, but just a wealth of information that I believe would be able to support your family. So at this time, I would now turn it back over to Judith for any additional comments and questions. You're on mute, Judith.
Yes. All right. Thank you all for sticking with us for just a little bit over the time. Janet, thank you for speeding through that. I apologize that you were pressed for time there at the end. If you do have questions for Janet, send them to help@autismspeaks.org, and they will end up in the right hands. If you have advocacy questions, you can reach us at advocacy@autismspeaks.org. And this, as I said, will be provided to you, this presentation, via email, and we're also recording it too, and we'll be posting that. So thank you for taking time to learn about advocacy and to be involved in your community, Virginia. We're very fortunate to be working with you and sharing this information with you today. Please take good care, and we will be back in touch.